Hi, good evening. I'm Brenda Foreman, Regional Long-Term Care Ombudsman with the Long-Term Care Ombudsman's Office in Connecticut. Here with you on Wednesday, October 18th, to do our monthly Facebook Live. So tonight I am going to do a brief presentation on dementia and memory care. I've prepared a slideshow, so I'm going to share my screen with you and we will get this started. Okay. So here we go. Okay, starting off with the basic. Here we go. Okay, starting off. Definition of dementia, according to the Center for Disease Control. Dementia is not a specific disease, but rather a general term for the impairment, ability to remember, think, or make decisions that interfere with doing everyday activities. Alzheimer's disease is the most common type of dementia. Though dementia mostly affects older adults, it's important to know that it's not a normal part of aging. There are many different types of dementias, hundreds of thousands, according to my research. They all have a little bit different symptomology, but there are some general common symptoms that you might be aware of. It's important to remember too that each individual that has dementia has a very unique journey, that symptoms aren't the same, they don't progress in the same manner. So some of the basic symptoms you might see, memory loss, confusion, and poor judgment, getting lost in familiar places, difficulty with money management, changes in personality, withdrawing from interests, difficulties with balance and movement, difficulties expressing thoughts, using different words for familiar items, repeating questions, requiring more time to complete a basic task that they're familiar with. And as you notice too, these symptoms could be symptoms of many different things. So certainly, confusion can be caused by an infection, dehydration. So there's a lot of, these symptoms could look similar with many different types of illnesses. Some of the terms that we hear related to memory care. We hear dementia with behavioral disturbances, challenging behavior, non-compliant, combative, agitated, exit-seeking, wandering. All sound very negative and I think contribute to the stigma that surrounds individuals having dementia or Alzheimer's type disease. Behavior is a form of nonverbal communication. It's important to know that. When someone loses their inability to communicate verbally, they're limited in terms of how they're going to communicate their needs going forward. Dementia doesn't cause a behavior. Dementia prevents an individual from expressing the cause of their distress clearly to others. Behaviors are simply a communication of an unmet need. When someone talks about a behavior with someone that has dementia, usually the behaviors are, again, a way to communicate something that's not right. Common things that may cause a behavior, sadness and loneliness, fear or anxiety, fatigue, some sort of a medical or health condition, perhaps boredom, being uncomfortable in their environment. So maybe it's too hot, it's too cold, it's too loud, it's too bright. Pain, and I tried to make pain a little bit bigger. Pain is one of the first things that should be considered when someone is having a new behavior or a continuing behavior. Research has found that individuals with dementia are more likely to not have pain identified and treated, of course, because they're not able to communicate that in a way that's understandable. Hunger and thirst, the need to use the bathroom, the need to move or change environment, or maybe frustration and anger. Back to the pain, just a story. An individual who was found to be having a behavior of banging their head against the wall over and over and over repetitiously. Once everyone got together, really interviewed the family, it was found that this individual suffered from migraines, had always suffered from migraines. So had that pain assessment been done properly, communication with the family, perhaps that could have been alleviated. Information from one sentence can create positive or negative emotional responses regardless of the stage of dementia. So even very end stage dementia individuals still are able to react to stimuli and have a positive or negative reaction to that. When individuals feel comfortable, they don't display challenging behavior. So instead of a challenging behavior, it's distress. I like to think of it as they're having distress. So how do we alleviate that distress? We alleviate distress by keeping people comfortable. So what does that mean? It's not any different than it would be for any of us. Comfortable means free from pain. It means that you sleep when you're tired and you wake up when you're refreshed. If you want to take a nap, you go take a nap. It means that you eat what you enjoy when you're hungry. Maybe it's not on the 3 meals a day. Maybe you like to graze. You receive your care on your own terms and from familiar caregivers. You're going to be comfortable if you're engaged in things that make sense to you and are meaningful to you. You're going to be comfortable if you have routines that are predictable. So if you're doing the same things that you always did do. You're going to be comfortable if you feel safe. And you're going to be comfortable if you experience an environment which meets your need at every level. Important things that you want to be able to communicate with a caregiver. You want to make sure that you are communicating routines. Routines are very important for all of us, really, but especially when you are talking about someone who has dementia. You want to maintain their long-term memory. So those things that they're used to doing are going to continue as long as you keep them in that routine. So looking at things like the bedtime, when do they go to bed? When do they get up in the morning? What do they do when they get up in the morning? What types of hobbies and interests do they participate in during the day? When do they have their meals? Identify terminology for items to avoid confusion. So make sure that you're clearly identifying to any caregivers different words that a loved one, family member, friend uses for different things. For example, a gentleman who had been in the service, who developed dementia, the term bathroom didn't mean anything to him. Being in the service, that was referred to as the head. So once the caregiver understood that and could communicate with him in a language he understood, he could be successful. He knew that when she said, "Do you need to go to the head?" he could say yes or no. Identify what provides comfort to your loved one. Is it music? Is it a religious service? A prayer? Is it a cup of tea? What is it that when your loved one gets a little anxious, a little uncomfortable, what is that? What are those things that provide comfort and can calm them down? Similarly, you want to identify any items that cause fear or anxiety for your loved one or general discomfort. As a general rule, many individuals that have dementia are fearful of the shower. So is that something that causes anxiety? You would certainly want to communicate that to the caregiver so they know that shower is not an option. You don't want to put them in a situation where they're going to fail. Identify important people to the caregiver by name and relationship, so that when the resident individual is talking to them about a family member or person, they kind of know the connection. It's important to identify medical history similar to the migraine. You know, if someone's got a history of migraines, you would want to know that. And maybe what happens when they have a migraine, if there's something that happens that you can tell that they do have a migraine. Similarly, trauma. If someone was in the service and has PTSD, for example, you may want to know that to avoid loud noises if possible, or you might want to have extra support if a fire alarm or some sort of an alarm goes off, to be able to provide that support and keep the residents as comfortable as possible. What I wanted to do is just provide the Connecticut general statutes related to Alzheimer's care units within the state of Connecticut, just so that everyone has a clear understanding of what they are. An Alzheimer's special care unit or program is defined basically as a locked or secure area that segregates individuals with memory care from a different group of people. So if there's a secured area that segregates, that's designated as an Alzheimer's special care unit or program. Within those programs, any facility, whether it's an assisted living or a nursing facility, they have an Alzheimer's care unit or memory care unit, something of that nature that's secured. What they need to do is they need to be disclosing to you the philosophy, the requirements, the criteria for admission and discharge, the assessment policy, staffing patterns, the physical environment, the activities, the family's role in care, in a written document. There is no rule in the state of Connecticut that a memory care unit has to have a certain staffing that's any different from the regular nursing home care. There's no separate license for an Alzheimer unit. Really, the only designation for the Alzheimer or special care unit or memory care unit is that it's secure and it segregates that population. Otherwise, ask for disclosures from those units that would address, again, the philosophy, the admission and discharge, the assessments, the staffing, and the activities. The other piece on the Connecticut General Statute that relates to memory care is the training of the staff. For a facility that has an Alzheimer's special care unit, be that a nursing home or a assisted living, they need to have 2 hours. Oh, wait a minute. Okay, any nursing facility that doesn't have a special care unit, I'm sorry. Any nursing home that doesn't have a special care unit has to provide 2 hours of training related to pain management and pain identification, and 1 hour of oral health and hygiene techniques to the staff. For a building that has a special care unit or a dementia unit, they need to provide 8 hours. All the direct care staff need to have 8 hours of specific dementia care training. And that is within, depending on when their start date, either within 6 months or 120 days of their start date. And then that's expected to occur annually. They also need to have the annual 2 hours training of the pain recognition and pain management for the direct care staff on the dementia units. And for the special care units, that for the non-direct staff, the unlicensed, unregistered, non-direct staff, need to have a minimum of 1 hour Alzheimer's dementia specific training on an annual basis. So again, for the facilities that don't have an Alzheimer's dementia unit, you need to provide 2 hours of pain management and 1 hour of oral health annually. For the Alzheimer's units within the assisted living and the nursing homes, the direct care staff need 8 hours of dementia-specific training along with the 2 hours of pain management and pain recognition. And for the non-direct care staff in the Alzheimer's units, it's 1 hour of Alzheimer and dementia-specific training per year. Family and loved ones need care too. And self-care seems to be a big catchphrase right now for all of us. But certainly if you have a family member, loved one, friend that has dementia, and you're providing some sort of care support to them, remember to take care of yourself too. So participate in things that offer care for your body, mind, and soul. Engage in activities that reduce stress. Join activities that promote well-being. Seek out support groups, and seek out a professional counselor or therapist if that's what you need. Some resources for you. The Alzheimer's Foundation of America and the Alzheimer's Association, the Connecticut chapter, do a lot of webinars, a lot of trainings, fabulous resources. Check that out. The next 2 resources are with our office, Aging and Disability Services. The first is for the Disability Resource Centers within Connecticut as a resource. The second is for the statewide respite care program. If you are caring for a loved one that has dementia at home and you need some additional support, some respite, please reach out to them. And the last resource is the National Alzheimer's Contact Center. It's available 24 hours a day. It's a helpline you can call with questions, concerns, and they can also link you to message boards. It's a good tool to have available to you if you need. And